right. So welcome to the webinar today, COVID-19 and the cardiac patient. My name is Andrea Baer, and I am the Executive Director of Mended Hearts, and I will be moderating today's webinar. Thank you for joining us. All of our attendees are in listen-only mode. You can ask questions by entering your question into the chat box, which is located on the right-hand side of your screen towards the bottom. Or you can raise your hand and the moderator can unmute you to ask your question during the question and answer period. I would suggest, due to the number of attendees that we have today, that if you can type your question into the box, it would make it a lot easier to get to more questions. Mended Hearts would like to thank the American College of Cardiology for their help in facilitating this webinar. We appreciate their dedication to all of the patients across the United States. Today, we are very happy to have Dr. Martha Gulati with us. She is a professor of medicine and the chief of cardiology at the University of Arizona, Phoenix. She held the inaugural Sarah Ross Sauter Chair in Women's Cardiovascular Health at the Ohio State University until 2015, and she is the author of the best-selling Saving Women's Hearts. She is the editor-in-chief at the American College of Cardiology, Cardiosmart, and the Patient Education and Empowerment Initiative. She serves as the chair of the National Chest Pain Guidelines. Dr. Gulati, I want to thank you so much for being here with us today. We appreciate it. And I will turn the webinar over to you.
All right, well, thank you everyone for joining us here today. I know that this has been the conversation literally everywhere, if not on the TV, every time I pick up the phone, every time anywhere you go right now, this is what we're all talking about. So I hope I can share some useful information for those of you specifically who have cardiac disease. All right, I'm not able to advance the slides, so I'm going to have to ask for, oh, okay, maybe I can down there. I don't think I have control of it. I'm gonna just, so today's program, what we're gonna do is have an overview about coronavirus disease 2019, also known as COVID-19. I'm gonna talk about some of the symptoms to watch for. I'm going to talk to people that are at the greatest risk of getting ill from the virus, because of course there are carriers and there are people who get quite sick from it, and they're very different people. And we're also going to talk specifically how the virus may affect the heart, and then most importantly, we're going to talk about stay healthy, also where to learn. Please. Coronavirus disease 2019, also known as COVID-19 for short, is a virus. No one really has any existing immunity to it. Unlike the flu, we have no vaccine to protect us. And as you all know, we are learning more and more every day. We don't know the long-term effects of this disease if you get infected, because we are just learning this ourselves. We know that this is an illness that affects the lungs and parts of the respiratory system, and it spreads easily. People can spread this virus without having any symptoms at all, and that is the reason that we have these stay-at-home orders and why we are encouraging social distancing. So as of April 1st, 2020, this is just showing a graph of how many cases were in the United States, basically early January to now. And over 200,000 people now in the United States have been confirmed with COVID-19. And in fact, I think this morning I read 265,000 people have been diagnosed. Now we know that not everybody has gotten tested, So we that maybe needed a test, especially early on. So there's probably higher numbers than this, but this is what we know as of from the CDC at this point based on the tests that are done. So the symptoms of COVID-19 are listed here, and the ones that we warn people about are fever, cough, having shortness of breath or difficulty breathing. And there's been some people who have reported a loss of smell or a loss of taste that may signal that they are infected. But that, I would say, is at the earliest stages because the majority of people actually don't report that. But those three symptoms are the symptoms that we are most concerned about, that things can turn pretty quickly in the wrong direction if they aren't at least addressed and evaluated to make sure that whether someone's stable or not, whether they need to be hospitalized or not. Most people who get infected with COVID-19 actually will have mild symptoms, and they can recover at home without actually needing to go to the hospital. But for others, and the ones that you hear about on the news every night, the virus can be quite severe, and it can result in pneumonia and also result in death. So anyone can get COVID-19 from what we're seeing, but certainly there are subgroups of people that are more likely to get very sick with this disease. And the people that we are identifying, both between our Chinese colleagues, our Italian colleagues, our Spanish colleagues, all of which have been sharing data with us, is that adults over the age of 65 seem to be at greatest risk. People living in nursing homes or long-term care facilities also are at the greatest risk, and people with existing medical conditions, and specifically heart conditions, see the group that is most at risk. Also with diabetes, any form of lung disease, including asthma, specifically who have moderate to severe asthma. Anyone who has a illness where their immune system is affected, they may have less of an ability to fight an infection. And of course, what we're seeing more and more now in the US is obesity seems to be linked to this as well. There's been some data also showing the relationship with even people with hypertension having a greater risk of developing COVID-19. So for those of you on this call, I know many of you have heart disease, and that the question really people are asking is, although it affects the ability of the lungs specifically, and many of these people who get very sick need to be intubated to get assistance with breathing, but also the heart seems to be the organ that gets exceptionally taxed, especially those who already have underlying heart disease said, and especially one that is weaker than normal. So how does this happen? Well, we know COVID-19 triggers an inflammatory response that can make the heart work harder. Lung infection in and of itself can lower the amount of oxygen that there is in the blood. And as a result, the heart has to work harder, it has to pump harder, because if there's less oxygen-rich blood in the system, it's got to beat faster, it's got to squeeze out more blood. Additionally, even the heart itself, if there's less oxygenated blood, the heart is the provider of the blood source to the heart itself as well, and it needs a lot of oxygen as well. As a result, this can result in drops in blood pressure if the heart can't actually meet the demands of the body. And like I said, from China and Italy, we've learned that people with heart disease seem to be at the greatest risk. There is other heart complications, though, that we are seeing, and I've had a lot of colleagues across the country sharing with us cases that they're seeing in New York and Louisiana and Los Angeles. I've had a lot of people posting this on social media, different cases they're seeing, trying to teach us so that we know what to expect when it comes closer to us. So some of the complications that we can see are things that inflammation of the heart muscle itself directly gets affected. That inflammation is called myocarditis, and that is pretty common for us to be seeing recently since it's come to the US. It also can cause chest pain and trigger heart attacks. Additionally, we've been seeing a lot of increased coagulation, and our Chinese colleagues warned us that that's what they saw a lot of. And even that increased coagulation, so creating blood clots, may also induce heart attacks in the arteries, because these clots can happen anywhere. They can happen in the ventricle, but they can also be caused in the coronary arteries. It can also result in heart failure. It can cause many different heart rhythm problems. So again, we're all learning from each other as these are happening, but this is what we're seeing, specific cardiac effects of COVID-19. Now, in the US, we're obviously just at the earliest stages, unfortunately, but we are seeing the cities that have been hit hard already. We are seeing what type of people are getting the diseases. And so this is based on the CDC data. I suspect this data will change, but right now the people a little bit of contrast to what people in Italy saw and what people in China saw, where cardiovascular disease was actually the #1 risk factor for getting COVID-19, a severe illness with COVID-19 and ending up in the ICU. Right now in the United States, it seems to be that chronic kidney disease or renal disease are the folks that are right now more likely. And that's often because people with chronic kidney disease actually have many of the underlying diseases. They may already have cardiovascular disease because they're so closely linked. They could have diabetes or hypertension or both. So, and again, because Louisiana was affected right now, disproportionately affected, representative in these numbers, there is a lot of comorbidities all linked together that we're seeing coming out of that state. But you can see, again, chronic kidney disease, cardiovascular disease, diabetes, people with immunocompromised conditions, people with chronic disease are the majority of the cases that end up in the ICU, and only a small percentage thus far, of around 2.5%, had no pre-existing conditions. So what can you do? I mean, that's the most important thing. There's a lot of things that we don't know yet about COVID-19, and of course it's scary, and of course it is. When you hear if you have heart disease, you're at higher risk, we're all worried then what could happen to our and specific those of you in this call. Well, there are steps you can try to avoid getting sick and feel more in control. The word pandemic doesn't make anybody feel that. But you do control, so please take it. Maintain your social distance. Social distance doesn't mean social isolation, and we'll talk about that more, but keep away from people, because there can be asymptomatic people in your neighborhood, in your community, knocking at your doors, where, even in your families. Just maintain a distance away from everyone until we get out of this. Keep up your heart healthy habits. If you have time right now, focus on you, focus on the things you couldn't do before, and focus on ensuring everything you can do to keep healthy, do it. Every night, I will give you just an example. I tell my husband the one thing we're empowered to do is eat healthy. So we eat a salad. Somehow he does it for me now, just because I tell him that one thing we're doing where we have some control. Sure, you take your medications. Don't change, don't listen to and decide to stop medications. One, you don't want to end up in the hospital right now if you can help it. There are too many people who are infected that are coming to the hospital. And additionally, it's a strange time. So if you can take your medications, you don't need to always call your doctors and ask them about it. They may not even be available if they're at the front lines of whatever's happening in your community. So please, please, please take your medications as directed. If you're thinking about changing, call your doctor's office and talk about it before you do it. Another thing to do is know the call for help. You need help because you think you're infected, that's one thing. But even if you think you need a doctor, you were due for a visit with your doctor, take advantage of things that we are offering across the nation, things like telemedicine, where you can ask questions and be connected to your doctor, maybe not in the usual way, as before, but between your doctor and your entire healthcare team, I know what we're doing in our hospital and other places are doing across the nation is we're all making ourselves available to our patients as much as possible. The last thing is to try to keep calm and stay connected. You already empowered yourself by coming to this call here today, so that's great. And once you know more information, I do think it will help keep you calmer. And of course, stay connected. Like I said, social distancing isn't social isolation. So you need to be connected to your community, and we'll talk about different ways that you can do this. Next slide. So when we talk about this social distancing, you know, we want you to maintain a social distance, and what that means is really limiting physical contact with others. This is a key public health strategy to curb the spread of this disease. And we are learning about this disease every day. So we're learning things that we might have said early on aren't exactly what now we're finding out. But what we know is that by maintaining social distancing between people, it will reduce the spread of the virus so that people who get sick can actually access medical care without overwhelming the medical care system. We call this flattening the curve, and I'll show you that in a bit, probably next, but that's why we want people to keep away from each other. We have the ability to impact what happens in our country if we all do this together. Ultimately, that will reduce the overall impact of COVID-19 on our communities, on our healthcare system, and ultimately it will save lives. Now, again, just to re-emphasize, it's less about distancing yourself emotionally, socially, or spiritually, but just physically. In fact, all the preceding things, the emotional, social, and spiritual, I would encourage that this is a time to take advantage. Some of my friends have told me, when else have their whole family sat down to have dinner together? They haven't seen that ever before. I have pictures of friends, children sitting down together, painting together as adults. She said she had never seen her kids ever do that in their entire lives. This is a time for us to connect in a different way and be together, calling people, be connected in ways that we weren't before, because often we didn't have the time. But physically, let's maintain our distance. Next slide. This is especially, maintaining that social distance is especially important, as I said, for those people with heart disease, just as people with heart disease are more susceptible to getting the severe form of this illness. And just research that has come out in the last few days has suggested the virus is not only spread by the coughers and the sneezers, but also just by breathing and speaking to someone. We've seen an aspiration of somebody's, spit when they speak, and we all do that, but it goes into the air and it spreads quite far. And this is the thing that we need to prevent from happening. And for those of you that are older, that, used to visit with your children often, or even your grandchildren, these are people to avoid for a while, as much as I know you don't want to. They may be asymptomatic carriers, but they may be carrying around COVID-19. And this is why we're telling people, even when they have close families, to avoid seeing their children and grandchildren if they don't live with you. And one of the big issues that we see, you know, from the Italian experience was that they didn't do this social distancing within their families. And as a result, you can see that what was happening there, I think that was one of the big issues that happened. So we again are empowered to change this. Next slide. Here's just, you probably have seen this curves. They've been shown on the TV. They've been shown literally in every newspaper across the nation. But this is what we can do. So if you see the red curve at the top, you can see that if we do nothing, if we all mix and mingle as normal, go to work as normal, do everything as we did before, there will really be no change. And all the cases will happen probably at the same time. They won't be spread out very much. Our hospitals in our communities will get overwhelmed, and we will have to make hard decisions and not be able to take care of everyone. The sickest people, the people at highest risk, if they all get sick at the same time, they're all going to need hospital care, and we don't even have the number of beds or ventilators, as you've been hearing about, to be able to take care of many more than we already are taking care of. Now, if we do in the blue line, we lower that. We delay the onset of our community of so many people getting COVID-19, and we'll also reduce the overall numbers, but they won't necessarily all get sick at the same time. That's just some actions, but if we do strong actions that's shown on the green line, we have the ability to not only reduce the number of cases we see in our community because we reduce the spread of the virus, but at the same point, we won't overwhelm the medical system. The black dashed line up here on the above the green line, that's sort of the number of hospital beds in the intensive care unit that we have. And so that if we don't have enough ventilators, we can't take care of everyone. And so that's our threshold that we're trying to keep under that threshold. So again, you know, that's why social distancing is so important, and perhaps the most important thing we can do in our community. And that is really why when you're hearing Dr. Fauci and others telling us that, you know, this is what we need to do, that stay-at-home orders are so essential. This is for everyone. This isn't that it just people with disease. This is also young people, because if the young people think that they're immune, they are carriers. And then if they go and meet with their mother or grandfather, for example, they have the ability to transmit this virus to them. Just because they feel well doesn't mean they're not a carrier. And that's why we're all in this together. Age is not protecting anyone in our community. Next slide. Other things that we can do, though, is, as I said, is keep up your heart healthy habits, or you can consider it a time to instill more. So choose heart healthy food and heart healthy snacks. For those of you that aren't used to being at home, the problem with being at home is we all tend to eat more. So we really need to have heart healthy foods at home. Try to eat balanced meals. Look at your plate. Make sure half of them are plate is vegetables. That can be just the one thing you do. Try using some healthy recipes that you've never tried before. What a great time to do it when you have more time on your hands. Make sure you stay well hydrated. Drink plenty of water. Get enough sleep. And this is so important. Aim to get 7 to 8 hours of sleep a night. For those of you that don't have to go into work for the first time in a long time, this may be the only chance you get to catch up on sleep. But even through this, these are ways to create habits for the rest of your life. This is just giving us a time to do it all together. Don't smoke, especially if you used to be a smoker and you smoked out of stress. Don't start smoking again now. And also don't overindulge with food or alcohol. There's a lot of jokes online. I know I've also been guilty of sending them out to friends because, of course, we're all wondering how to spend all this time with spouses and family all under the same roof. But we really do need to be careful. I'm really considering what's going to happen to the weight, not just of my family, but my friends and my patients, because again, everybody's saying that we stocked up on food and it wasn't necessarily the most healthy food. And we really, you know, a lot of the food that has long shelf life, a lot of that food is processed food, which is high in salt and also high in calories. That probably isn't the best food to be eating. The food that can last longer, things that last in the freezer, like frozen fruit, frozen vegetables. If you get to order some additional groceries, those are the kind of things you want to get into your house. Not so much the processed food, not the junk food. Healthy snack food is what you want in your house. I think if you don't have it in the house now, you won't eat it. So that's another way to think about it. Make sure you follow up on your own healthcare plan. Know what your doctors wanted you to do at this point. Make sure you're doing them. Stay up to date on your vaccinations. It's still, we're still in flu season, even though I know everybody's worried about coronavirus. You can still get the flu, and we still need you to make sure that you did get the flu shot. Make sure you exercise daily, even with the stay-at-home orders across the nation, and most of the states now have a stay-at-home order. They do exempt going for exercise at least once a day. And it really is important for you to get out and get some exercise if you're able. And if you're not able, we have some suggestions for you as well. But getting some exercise every day is so important. It'll help you keep your sanity, keep calmer, feel a little bit in control of your life. And, the endorphins from exercise always make us feel good. So what are the things that you can do to keep up with exercise? Because exercise, it keeps your heart healthy. It also improves your immune system. And staying physically fit for these long periods while we're at home is so essential. So for those of you that like computers or like things that you can access online, or if you have a smart TV, you can access the online system, lots of online workouts. Many of them are actually free during this COVID-19. There's apps that you can download. The New York Times app of just doing simple exercises at home is free. So make sure you look for that and share with friends. They will all tell you what their favorite workout is that you could do online. And if you don't know, you can always contact other friends who work out at home and watch them either on FaceTime and other things, so that maybe you can lead each other to do some workouts together. If you're fortunate enough to be in an environment where you can get outside, go out for regular walks and for fresh air. Both of them are healthy. You shouldn't sit inside all day long. So it really is encouraged, even if it's still cold in some parts of the country, get outside, just dress up for the cold and get outside. If it's getting warmer in your neighborhoods, then that might be a great excuse to do different walks but again, you want to maintain that social distance. You could think about making a family step challenge, and that families with you or not with you. And everybody at the end report whether they their phones, or whether they use a Fitbit, or whether they use an Apple Watch, or whatever your favorite device is. Track your steps and aim for at least 10,000 a day. And maybe there's a reward in the future for the person who achieves the greatest steps for that day. Or maybe it's a whole COVID stay-at-home challenge that you guys see who has the most steps by the end of this. And even in your house, there's a lot of things you can do. Go up and down your stairs if you have stairs. Remember, even doing things about the house, whether it's cleaning. I know nobody wants to clean, but it is a great time to get caught up on your spring cleaning. Whatever you do, is going to count as activity, because it really is important, whatever we do around our houses. So think about creative ways to create activity at home. I don't know if any of you saw the really funny thing that came out of Britain. A man ran a marathon in his backyard. I can't even remember how many laps he had to do, but that was quite fun to watch. I don't know how fun it was for him or his family, because it must have been pretty boring, but it still was a really creative way to keep active. Other things is like, you know, if you're getting into the springtime, spring, like I said, has sprung, so start tending to your garden if you have one, or consider even creating a garden. I am a big gardener, so I really do love gardening, and that of course I'm in an environment where you can almost garden all year long, but for those of you that are in the north, this is the time to start planting your garden, and that way you can have vegetables all year long. So think about even creating a dance party at home, and just turn on some music and dance with your spouse, with your children remotely. If they're not with you, it can be really, really fun to, and actually, given the things that you can do on using apps like FaceTime, it can be quite funny. Asking everybody to do the dance move that the next person, you know, one person introduces at a time. Next slide. Now, about taking your medications. I know this is what the commonest calls I'm getting from my patients about what certain medications. Make sure you take your medications unless you've been directed or told otherwise by your healthcare professional. We have gotten tons of calls about the certain medications that control blood pressure or are used for heart failure, specifically ACE inhibitors and ARBs. I don't know why this all started. Well, I do know a little bit why it started, but I will tell you there is no data, there is no trials that people who are on ACE inhibitors or ARBs are more likely to get COVID-19. That is not true. I know it's been spread through the internet. Even journalists have called us asking, and we have tried really hard to get the message out that these medications do have a benefit. They're protective, especially for those of you who have heart failure, hypertension. You might drugs as well, but just stopping these drugs doesn't make sense. There's no data supporting that you're at more risk. So please, please, please stay on these medications. Don't stop them. And if you're for any reason considering stopping them, talk with your physician, talk with your healthcare team, because I think we put out a universal statement from the American College of Cardiology and the American Heart Association, and the European Society of Cardiology also put out the exact same statement that we all do not want these drugs to be stopped. Similarly with statins, we don't want people to stop taking their statins, and that has been also recently some interesting papers coming out, but the end recommendation is there's nothing supporting that statins increase your risk of infection with COVID-19. If you're, in fact, there may actually reduce inflammation, and for this reason, if you're on a statin, take your statin, please, please, please. If you have questions about supplements, vitamins, or you read something online about the latest or greatest cure to COVID-19, I hope you will know that we have no, just be taking vitamins and supplements that make your urine really expensive, and that's okay as long as they're safe. And again, remember, things that are over the counter aren't always safe, even vitamins and supplements, depending on what drugs you are on. So it's important, if you're starting something new, to talk again with your healthcare team, because you might be putting yourself at risk just thinking you're doing something good. There is none, I'm sure many of you might send me questions after this saying, well, I heard that this supplement will save my life or protect me from COVID-19. I will tell you again, there is nothing out there. There is no, if we had a magic cure, believe me, we'd be sending it out to everyone, or somebody would be stockpiling at the very least. There is nothing magic cure yet. And hopefully we'll get vaccines. Hopefully we'll figure out now, as we are taking care of patients, figuring out what works and what doesn't work. but there is right now no over-the-counter magic, so I would save your money if I were you. Try to make sure for the medications you're on that you at least have 1 month's supply. Even ask your pharmacist to contact your doctor and see if a 3-month supply might be provided. I know that is a lot affected based on your own insurance, but they may even will be a little relaxed time. I've had many patients call us and we've been able to get approval from their insurance company to give them the 3-month supply, even though in the past they weren't allowing it. They do understand there is a COVID crisis pandemic going on, and they are also softening up their rules a little bit, at least some of them. For your pharmacist, if you don't want to go out, you may find a pharmacist where medications can be delivered to your home, or certainly if you've got enough for a while, you might ask if they can mail order them, or if your insurance allows a mail order option, this might be the right time to get it activated. Just again, to minimize you going into the pharmacy if you don't need to. Next slide. Remember that we are all rapidly shifting to telehealth. I think this is perhaps the best thing that's happening about this pandemic. There's been little impetus from healthcare systems to really shift to telehealth. And there's many times that I can tell you that my examination of my patient hadn't mattered for what my plan was. Of course, there's sometimes I do need to hear your heart and your lungs and check out your feet for swelling, but that's not always. Sometimes we just need to either adjust your medications or talk about preventative care or whatever it is that we need, and then the physical exam may not matter. As a result of the COVID-19, we are shifting pretty rapidly to telehealth, understanding the limitation that we can't examine you. So ask your physician offices, the medical offices, if either if you had a routine visit and you're feeling good, maybe it can be delayed by a couple of months, or maybe they'll say there's no need for delay because we're going to offer a telephone or a telehealth call. Telephone visit is possible for many places. Some, if you have access and know how to use your computer system pretty well, you may be able to download your hospital or healthcare point. Some are using something called Zoom, some are allowing some their own system, and that's what makes it a little bit complicated, because some require very little for you to load and some require you a lot to download, which I know can sometimes be a barrier. But at a minimum, I've been offering to my patients telephone or even FaceTime calls, but either one is an option for you, especially if it's a quick thing. If they need to see you, they'll tell you if they need to see you and make appropriate measures, because if it's emergent for you to be seen, then what we've been doing is getting people to wear masks in, and I'll wear a mask in to see my patient as well, to protect us on both ways. So talk with your healthcare team, find out if this would be appropriate for you. And again, if you're feeling good, maybe just even delaying the visit for a bit, because again, things will change pretty rapidly, I think, in a couple of months. Next slide. Obviously, it is important for you to know when to call for help, because we also don't want our patients with heart disease to feel isolated. And I know that is one of the things that you feel like, well, if I can't see my doctor, what do I do? First of all, if you think you have COVID-19 or even been exposed to it, consider first calling your doctor's office, your primary care specifically, and see what their recommendation is. And if you don't have a primary care physician, because not every cardiology office can actually screen for COVID, like not everybody is set up to do that. So you might, if you don't have a primary care physician, it may be that you'll be directed to call the emergency department in your hospital first. It's important to call them first before going in, unless, obviously if you're critically ill, you must go in and you must call 911 as usual. Those rules haven't changed. And in fact, we've been concerned because we've been hearing reports of people having heart attacks at home, and they've been sitting on their symptoms because they really didn't want to go into the hospital hospital. So don't be that person. We still are activating our cath labs and doing the things that need to be done acutely to save lives. And that part you should never question. But if you're worried about COVID-19 exposure, talk with your primary care physician or talk to your local emergency department. There's a lot of public health postings in your community of where you can get testing. Most of them are through drive-throughs, but most of them require that you schedule with them an appointment. So you call a number, you tell them what your symptoms are. They say, okay, you need testing, or no, you don't need testing. And if you need testing, they'll say, come at 2:15 through our drive-through, and they'll tell you the address closest to your home. So that's what I would recommend. Certainly follow the CDC recommendations about staying at home that we talked about, isolating yourself from others, at least physically. Monitor your symptoms. If you think you've been exposed to COVID-19, just monitor yourself at home. That's ultimately what your doctor is probably going to tell you if you're asymptomatic, but you know you've been in contact with somebody with COVID-19. There's no treatment, so there's nothing really we can do until we really see that something's going on. Because if you're lucky, maybe you'll just get the virus, but you won't get sick from it. And that's our hope, obviously, for everyone. Ask about wearing face masks. I know that there's been a lot of controversy and nobody seems to agree with anyone from both public health and onward. I think we've watched different communities, different countries do different things. I think China and South Korea, they really did use masks on everyone, and it really did reduce transmission from person to person. If you have a mask or if you have a bandana, if you don't even have a bandana, using a scarf when you're out will be at least a way for you, if you're infected, to not pass it on to someone else. And similarly, for those people around you that you might come in contact with, to not be exposed to somebody else who is infected. Certainly avoid sharing personal household items and clean, frequently touched surfaces all the time, which includes things like mailboxes, door handles. You come in from outside, washing your hands. The washing your hands is perhaps the best thing that you can be doing every time you touch something. And obviously, if your symptoms get worse, if you start running a fever, if you start noticing a cough and you know you were exposed to someone, or even if you don't, any of those symptoms, you start feeling short of breath, contact your doctor, or if you think it's quite critical at that point, call 911. It's important for us to still use our healthcare system for critical situations, and that's why we're here. There is a website that you can see listed below. It's a CDC website, and it's about coronavirus, and it's the steps to take when you're sick. But there's a lot of information there as well, and we'll lead you at the end to some of our other favorite websites, including our own at the American College of Cardiology, which is our Cardiosmart website that we have dedicated right now, an entire section to COVID-19. So when do you call for help? I mean, again, anytime you think it's an emergency, you call 911. All the things that your doctor's already taught you about your heart condition and when to call 911, those don't get thrown out of the window. Still call 911. If you think you're having a heart attack, you must call 911. If you think it's an emergency and you need someone right there, right now, call 911. But specific to COVID-19, if you're having trouble breathing, if you have severe dehydration, if you're extremely confused or know that you're thinking clearly, that sometimes could be a sign that you're having a fever or that you're dehydrated, or both. And certainly if you and your family passes out, that's time to call 911. I know if you pass out, you can't necessarily call 911, but if you're unfortunately alone and you wake up and realize that you passed out, call 911. If you have a high risk of being exposed to the virus, or if you tested positive but you don't have any symptoms, like I said before, you should call your doctor. And if you develop any symptoms like shortness of breath, fever, cough, that would be a time to call your doctor and ask what should you do, if anything, and then they might advise either come to the emergency department or whether they think you should call 911. Obviously, if you're having symptoms that you're monitoring at home and they start getting worse, that might be a time to call 911. And if you have, whether you have symptoms or not, you still should call your doctor. Make sure that they know that you either think you're infected or maybe you already tested positive, so that at least they're aware. So if they get a phone call from you later, they can make the best recommendations for you. If you do have to go out and you know you've either been exposed to someone with COVID-19 or you know you're positive, even without symptoms, if you go outside, I would recommend that you wear a face mask. And when you go to a doctor, if they actually give you an appointment because they want to see you, again, you should wear a mask coming in. So again, we have a website with this information. This is from our Cardiosmart website up at the top there. It's www.cardiosmart.org, and then you do the hashtag, the / for coronavirus, and then there's actually more information of when to call help. So you can go to that website. That's one of the resources as well. There's a lot of misinformation online and also being shared by email. So we just don't want you to, we want this to be a reliable source through Mended Hearts, through Cardiosmart, through CDC. We want to make sure that people are going to reliable places or sharing reliable places with their families and friends, because we do not want you to think that there's some other websites that might be very misleading. Next slide. Remember that it is important to reduce your stress as much as possible and try to keep calm. I know that we're all anxious and we're all uncertain. That, you know, this is a real situation that nobody really entirely knows how to handle. And I say that as a physician who, again, every day we have to go to work and we have this uncertainty ourselves. So believe me, I'm with you on this, and I am always trying to figure out how to keep calm, because I'm sure you, like me, have had sleepless nights wondering about this and how it's going to affect all of us, our loved ones, our patients, everything. And that races through my mind too. So be sure to mind your own mental health. It is so, so important. Make sure you use this time wisely. When are we going to ever have this much time in our homes? Grab a favorite book. Maybe if you're a downloader, you can go back to your favorite list, or even get access to your library online. A lot of their books are now, they have them available electronically, and I led my own mother-in-law to a place so that she could download some books at her library. She didn't even know that they were free and available. So watch lighthearted TV, you know, either a show or movie. Don't always listen to the news, because the news is stressful enough. Limit your news watching. Maybe that would, you know, and especially don't listen to it right before you go to bed. It doesn't, I can tell you, it doesn't help you sleep. Listen to, if you love music, listen to your favorite music or discover new music. This is a time. Think about meditating. There's actually some lovely apps that you can use, that you can download onto your phone. There's things online that you can use. And if you don't like any of those or have access to any of those, you know, just practice your own form of meditation. Even prayer is a form to some degree of meditation. I don't say that insultingly at all, but it can be a way for you to get to a different place. And that's the point of meditation, is to calm yourself down, and sometimes that can help people. Practice something that you did or do that can really help you. It lowers blood pressure, it reduces stress. Think ways. We've spent time making up our funny in my family. Sometimes they're not even funny, but that makes us laugh. Find other ways to unwind. You know, if you have a workout machine that's been holding your laundry for the last year, maybe that's a way to get all those clothes off of it and start using it. That'll give you some way to occupy time and also help you relax. I said limit how much you watch the news. I know it's stressful watching it. We need to be paying attention, of course, but we don't need to have it on 24/7. If you're at home a lot right now, I never have been at home that much before, you know, create a routine and structure to your day. Make sure I still set the alarm every day. Make sure you have a plan, eat breakfast as normal. Every day shouldn't be a holiday. Maybe you had a couple days holiday, but now bring some structure back to it. And for maybe you to go and friends and play bridge or do something with people, maybe that's the time that you now spend calling those people that you spend time with, and check on other people, because that can be also very helpful on both sides. Next slide, please. Remember to stay connected. As I said this now probably too many times, but social distancing is not social isolation. It's just about the physical distance we need to keep from each other, but it is so, so important to stay connected. At a minimum, reach out by phone, use email, do video chats if you can. If you have family that live in different time zones and you can't get a hold of them at times, maybe make them videos and just send them to them. Maybe it's a time to learn everything about your phone, because your smartphones actually do a lot of great things. It's just most of us don't know all the great things that they do. Think about finding new hobbies. You know, this is a great thing that you can learn on, especially online. You never crocheted before. Believe me, there's somebody online that can teach you how to crochet or knit or sew or whatever it is that you wanted to make. You wanted to make up all those photos that you've been holding on to and not making books out of. This is the time you get all done. Forget about local community resources and ways that you can even help from a distance. There is actually a lot of things that they're asking people to help do. Some people are making and sewing masks from home for healthcare workers, even for the community. So these are things that you can do potentially even from home. Remember to find every day things that give you joy, your spirit. So important. And use some of the coping strategies you've learned in living with heart disease. And you know this better than anyone else. All of you from Mended Hearts know that you've been able to talk about your feelings, and talking about how you feel about COVID-19 is important as well. We all know each other. We're all in this together. And believe me, sometimes sharing it with others can help you feel like not alone in this. And sometimes if you're at home, you will. If you have questions specifically about the virus and your own health, then of course call your healthcare team, because you want reliable answers. I think that my worry is if you share it with other people who don't, they may just increase your fear, and that's not good either. But things about just how you're feeling, it's important to share. Now, if there's any parents of patients who have congenital heart disease, children who have congenital heart disease, know that, again, these might be a group that is at higher risk. We just don't know enough about them. Again, we'll see what our own US data holds, but heed any orders to stay at home. Limit the contact of these children with congenital heart disease with others. Really do maintain social distance in this group specifically, and stick to the care plan already been put in place by your doctors. Children don't seem right now to be the high risk group at all in this particular virus of COVID-19. And if they do get symptoms, they tend to be mild. But certainly if you have a child who gets cough, fever, chills, or if you even a family member has been exposed, call your primary care doctor. But if it's another family member that you think has been exposed, my recommendation would be to keep that exposed family member away from the child who has congenital heart disease. And certainly if you or your child has more severe symptoms like we already talked about, but including trouble breathing, they're not eating well or feeding well, they're not urinating as often, that's sometimes a sign of dehydration. Obviously if they lose consciousness, then you must call 911 and seek medical attention. So I wanted to leave you with resources of where to learn more. We mentioned them through the talk, but the CDC has its website. I know it gets repeated on the television quite often, the www.cdc.gov/coronavirus. And even if you just remember the first part, the cdc.gov, if you put that into your search engine, I'll tell you right now it's opening on the coronavirus page. So if you can get there, you'll find that information. They keep putting up updates there, and that's important for us to all look at. Now, we have stuff specifically related to people with cardiac disease at our Cardiosmart website, and our Cardiosmart website is www.cardiosmart.org. It doesn't put the capital C or the capital S in, to be honest with you. And then you can do the /coronavirus page, and we continue to update that, and we also are making a lot of our content both in English and in Spanish. So if you have Spanish speaking friends that need this information, please pass that on. The ACC is continuing also have a COVID-19 hub, and that is mostly for physicians, specifically for cardiologists. The www.acc.org, and it's /COVID-19. That website is trying to keep our cardiology community updated with latest science and data, but you can also look at it and see if there's important information. And both of those last two websites kind of talk to each other. So if you find it overwhelming and a little bit too medical, that's okay. It'll lead you to Cardiosmart as well, and you can go there as well and maybe get more of the information that we're translating for our patients.
Great.
So I think that I am done now, so except for questions. So I'm going to hand it over back to Andrea.
Yes, thank you so very much. It was great information, and we have tons of questions, and I know we don't have a lot of time, but I wanted to, we've been trying to scan the questions and kind of do some buckets of questions, and maybe if you wouldn't mind, I'll go ahead and give you just a couple now to start with. And one is important, and it's like with pacemakers, ICDs, mechanical valves or replaced valves, do they feel that they can get infected from this virus? Is that a problem that we're seeing?
You know, it's probably too soon for us to entirely know that just if you have a device or a valve in place, if you're at greater risk than anyone else with cardiovascular disease. I think that we would bucket them all into the you have previous cardiovascular disease and might be at higher risk. And I think that's the best answer I can give right now. We are going to learn a lot of more after this is over as we're sharing information. There was nothing, I spent a lot of time waking up at the wee hours to learn from my Chinese colleagues who shared their experience and their information, and they didn't mention that specifically as watching out for. I think after this is all over, we'll all put all our information together, and there's probably different lessons for different countries, but I would say you're still a high risk group. And so just know that. And again, the social distancing is important for you no matter what.
Perfect. And what about going to the dentist? Is there anything that is it more dangerous at this point? I know that most of the dentists now are not taking regular patients. They're only doing emergencies. Can you talk about that a little?
Sure, yeah, this, so the dentist, as all of us know, the dentist gets quite close to our faces and us, and they do a really good job because they've been a long time using personal protection and to protect themselves, with masks and eye etc. But right, like you mentioned, basically only thing dentists are advised to do is emergencies, not elective stuff. So right now we are recommending that because of two-way risk. There's just people being exposed. It's at risk for the both dental community as well as patients. So right now you'd be very unlikely, unless it's emergency, to see your dentist.
Okay, great. Thank you. So it says somebody asked, cardiovascular disease seems to be a very broad term. Are there any specific parts of cardiovascular disease, for example, somebody who had stents or something related to the heart muscle, maybe heart failure? Is there a specific type of cardiovascular disease that seems to be more susceptible?
Like I said, unfortunately, we don't have that information yet. You're right, it is a very broad term and it can mean so many different things. It spans from having coronary artery disease, which, like having stents. It can also be heart failure. It can have pacemakers. It can have defibrillators. It can be people with congenital heart disease. It can be people with atrial fibrillation. And right now, they all get clumped in the same group because right now we don't have enough information. And so right now, our recommendation is for anyone with any form of cardiovascular disease to be careful. And to be the group that we are the most concerned, or not isolating it to specifics, because we don't have that information yet.
Great. So one more question, and then it will be the 4 o'clock hour. What does what is the time from you being exposed to getting symptoms? Is there a cutoff date that you can say I passed that?
It's funny, we're learning a little bit about that too, but it's seeming like exposure and then symptoms can occur sometimes very quickly within a matter of days, but also can be up to 14 days. And but for most, after 14 days, if they've been exposed to somebody, it's less likely that they're going to get the symptoms after that, but it's not impossible. And it depends, of course, how long they were exposed to somebody, and if they had repeated exposures. It's very difficult. So again, we're trying to minimize, again, for this time and period in our country, really exposure to anybody. I know that seems weird, but except for the people you are living with immediately, everyone else you should try to stay away from.
Okay.
And we didn't actually talk about it. I wanted for, especially for the Mended Hearts folks, to know, again, I know that some of you I saw some questions even before we started, but there was like about groceries and things like that. If you can grocery shop online, do that way. Anything that you can have delivered is your exposure to other people. And a lot of people are just dropping things off at your house and walking away. And there's been at least no reports of getting coronavirus, handling food and from containers and things that we're opening up in our house, but still use the protective measures that you would. If you bring in the boxes into the house and open them up, again, wash your hands before you do it, wash your hands after you do it. Wipe off things that you are taking out of boxes or delivery. Just a quick wipe off. There's no need to use bleach or anything else. Maybe use dish soap, but wipe off things. Wash your fruits and vegetables the way you would normally wash your fruits and vegetables off. Nothing, you don't have to like sterilize them because they'll become unedible. If you want to peel them because it makes you feel better, that fine, but you're losing some fiber nutrients. But it's okay, we'll forgive you during this COVID-19 time. Again, if you don't have to go out to the grocery store, if somebody can drop it off for you, if somebody can deliver it, take advantage of those things right now.
Great. Well, thank you so very much. And thank you all for joining this webinar. It has been fantastic. I'm sorry we couldn't get to all of the questions, but I will work very closely with the American College of Cardiology to get these questions answered. And we will be placing this video out on YouTube, and we will also have a question and answer document that we can share that maybe can address some of the other concerns. So please bear with us and we will get that out to you. Dr. Gulati, thank you again very much for taking the time out of your busy time to talk with us today. We really appreciate it.
No problem. Keep safe, everyone.
Thank you. Everybody have a great day.